Each of these leads are looking at our operations and providing recommendations to me on our response. So let me just start by giving you a few numbers. Last night, we announced 3 new presumptive positive cases of COVID-19 in Washington, D.C. One of the new cases announced last night was a member of Christ Church, Georgetown. It's already been announced that the rector of the church tested positive for COVID-19 over the weekend, and on Sunday, at D.C. Health's recommendation, the church suspended all services and meetings. On Sunday night, D.C. Health announced that they were recommending that all people who visited the church either on February 24 or between February 28 and March 3rd self-quarantine for 14 days since the last time they visited the church. As more presumptive positive results come in and DC continues to conduct contract tracing of these patients, we expect that the number of people tested in our city will continue to climb. So far, our public health lab has not had any problems with testing capacity, but that could change. And we continue to call on our federal partners to ensure that not only we have the testing materials, but the supplies needed to make those tests work. Obviously, this virus has a ripple effect, and it is critical to understand who in our community is affected. We continue to reiterate to all the members of our community to do your part in preventing the spread of germs and this virus. And I know Dr. Nesbitt will reiterate all of those factors. So let me now turn to Dr. Nesbitt for an update from the Department of Health, and then we should be able to answer your questions.
Thank you, Madam Mayor. As Mayor Bowser stated, last night the district confirmed 2 additional cases of presumptive positives in the District of Columbia. It is an update from last night, as during our additional contact investigations, we discovered that one of the confirmed positive cases that we announced last night will be attributed to the state of Maryland. One of the confirmed or presumptive positive cases newly announced today is affiliated with the case that we announced over the weekend from Christ Church. They were already known to us and was self-quarantining at home and developed symptoms. And as a result of developing the symptoms, the individual was tested and now has become our 3rd case in the District of Columbia. The 4th case in the District of Columbia is an individual who participated in the Biogen conference in Massachusetts, where 3 persons who returned to Europe tested positive for COVID-19. This individual developed symptoms, was known to the District of Columbia, and tested positive. And so that brings our total presumptive positive cases to 4. We continue to work closely with our other health departments in the region, as well as district agencies, to prepare and have our adequate response in the District of Columbia, where we remain in a containment phase of our response. We want to continue to make the residents of the district aware that we remain in a low-risk situation in the District of Columbia for the general public, as the 2 additional cases that we are announcing today have known exposures. We encourage residents to remain up to date by visiting the coronavirus.dc.gov website for additional information related to the prevention of coronavirus, as well as receiving additional information for testing. We also would like to remind people of things that we can continue to do to prevent the spread of coronavirus and COVID-19 in the District of Columbia, which is to continue to practice great community hygiene, first beginning with staying home if you are sick, remembering to practice good hand hygiene, such as washing your hands for at least 20 seconds, and covering your cough discarding all tissues immediately. If you do not have a tissue, being sure to cover your cough with your elbow or your sleeve, and remembering to call ahead to your healthcare provider if you believe that you are sick. One of the things that has been very helpful for us with the close contacts of our cases is having them call ahead to healthcare providers when they develop symptoms, so those healthcare providers can be prepared for them in their waiting rooms or at the emergency rooms if they are arriving to an emergency room or urgent care to be tested. That helps us to reduce the risk of exposing additional people to COVID-19 in the District of Columbia.
Questions? Mark?
Can I just clarify, Dr. Nesbitt said 4 cases, but 5 is the number for DC, is that correct?
It is 4. So last night, just to be clear, we reported that we had 3 new cases in addition to the 2 that we already reported. One of those 3 is actually a Maryland case. So we have adjusted the numbers that we have reported.
So, but I thought the CDC was pretty, so that has changed the way you're tracking that, 'cause up till just now, the CDC was attributing that to DC, and we were at 5.
I'm sure what the it is you're referring to, but we have 2 cases that I mentioned in our last press conference. One in a Maryland hospital, that is a DC case, so that's the 2. We reported 3 last night. Of those 3, one of those is actually a Maryland case. So it is not 3, but 2 new cases. Yes.
I know the Loudoun County case that was discovered today that had a connection to Christ Church, that's considered a Virginia case?
As I understand it, and I'm going to ask Dr. Nesbitt to confirm, but the cases follow the state of residence, it follows the state of residence. And so I'll ask Dr. Nesbitt to speak to anything we know as of yet about that we've heard from the Commonwealth about additional cases.
Yes, the mayor is correct in that the cases follow the state of residence. It is not necessary that it follows the state of where the healthcare is being received or the state of laboratory testing.
So the 79-year-old man, is that a Maryland resident? Is that why it's been reclassified as Maryland?
There may be lots of 79-year-old people that you are referring to. Okay.
Last night there was a 79-year-old man reported. There was a 77-year-old from Biogen, and I don't know the third one, but the 79-year-old one, is that the one that was reclassified to Maryland?
Correct.
And because that person's a Maryland resident?
Their place of residence or where they are staying while they are in the region is Maryland.
And with Reverend Cole, have you been able to figure out where he might have contracted this virus? Do you suspect that it was in Louisville, Kentucky, where there was the Episcopal Conference?
Our contact investigation is still ongoing to identify a known exposure.
Can you clarify, why are we calling the presumptive cases and not confirmed coronavirus?
Thank you for the question. Since we began testing in the District of Columbia through the Department of Forensic Services Public Health Laboratory, all presumptive positive cases still must be sent to the CDC for confirmation. Until the confirmation has occurred at the CDC laboratory, they are classified as presumptive positives.
And how long does that process take?
It may take several days to receive confirmation from the CDC. It does. That is correct. That is correct. It does not change the clinical or public health management of the individual.
Mayor, you spoke about the number of tests increasing. Did you mean that you expect, as you get more tests and more capability to test, that you expect the number of actual cases to increase?
Likely. Want to add anything, Dr. or Dr. Smith?
So there are 2 approaches to that question. We have a case definition for persons under investigation, which follows very closely the travel history of individuals. So whether or not they have signs and symptoms and have a history of travel to a level 2 or level 3 country that has a level 2 or level 3 travel advisor according to the CDC, or a community that has sustained community transmission, which gives us some latitude to look at domestic travel in the United States. The other thing that we take into consideration are people who have a history of being in a long-term care facility or a nursing facility and are demonstrating signs and symptoms of COVID-19. We also look at testing individuals who have respiratory failure or severe respiratory disease and signs and symptoms of COVID-19 where there is no other diagnosis to date. And so our criteria is quite expansive in terms of persons under investigation. We test people who have a known exposure to a laboratory confirmed case of COVID-19 and are demonstrating signs and symptoms. So those are the major criteria that we are using now for testing individuals. As tests have become more widely available in the U.S., including through commercial laboratories, it is anticipated that more people may be tested in the